Our next guest today is Dr. Delwyn Lofney, chiropractor in Springfield. Welcome. Everybody calls you Dr. Dale, correct?
That is correct.
So, at least that's what I call you. So, Dr. Dale, welcome. Thank you for being here today.
Well, it's nice to be here.
Yeah. So, I want to talk with you about chiropractic services. You have an office in Springfield and out at the shopping center. And I'm not sure what that address is or what that's.
It's 113 Lincoln Park Road.
Okay. And of course, it's in the shopping center. I call it the annex there next to IGA. And but you've been here how long now?
I've been here 4.5 years now.
Okay. Live in Springfield, in Washington County.
We actually live in Lebanon now. We did start out in Springfield.
Oh, traitor. You moved to Lebanon? I didn't realize. I thought you were here in Springfield. But anyway, your office is here in Springfield, and that's good.
Yes. We
And
didn't move that far away.
right. Well, yes, that's right. And we're all one big community anyway, Bardstown, Lebanon, and Springfield. And so I want to hear, chiropractic services, really, even though chiropractic, how do you pronounce that? Chiropractic services have been around for a long time. Still, it's surprising to me how often when you talk with people that they really don't know much about that.
Yeah, chiropractic actually came into being about 1890 when D.D. Palmer was communicating with his janitor, Harvey Lillard, excuse me. He was deaf. He'd been deaf for 17 years. D.D. Palmer was communicating with him and found that something was out in his back. He adjusted him, and his hearing came back. Now, that's not to say that chiropractic treats hearing loss, but what we do is we find areas of the spine where it's not moving like it should, and therefore it's causing irritation on nerves, and which then the nerves go to every part of the body. We remove those segments through an adjustment, and it gets them to free up those nerves, and everything improves.
Yeah. Well, as the old song goes, the hip bone's connected to the whatever, the the ankle bone, I'm not sure, the leg bone, but everything is connected in the body. And I know that you showed me how the nerves are connected to the muscles and muscles to the bone and all of that kind of stuff. So I guess it only stands to reason that if you do some type of adjustment that's going to help your bones.
It helps everything. I like to use the analogy that your body's a lot like the Golden Gate Bridge. If you can imagine, your spine is basically the deck of the bridge, and then the suspension cables, that's your ligaments and muscles. If those muscles start tightening up and in some spots and loosening others, it's going to cause that deck of the bridge to start twisting and turning, and eventually no one can cross the bridge.
Yeah.
The same thing with your body. If the muscles start tightening up in some areas, it's going to start causing the bones and the spine to kind of twist and turn, which then causes further problems. What we do is just find those areas and get them moving. And we do have a massage therapist in the office, and she helps relax the muscles. And then after that, adjustments are much easier.
Yes. Well, so her job is to relax the muscles, and then after that, you do an adjustment, which just kind of puts. So what do you mean by an adjustment?
A lot of that depends on the patient, comfort level. We have some techniques that are very gentle, that don't cause very much pain at all.
Yeah.
And then we have some techniques that are a little more manual and can cause some discomfort. So a lot of that depends on the comfort level of the patient. But we put a force into the joint. We find the specific joint, put that force into it, and it moves. And once it starts moving, certain chemicals are released into the body, which then helps things relax, makes you feel a little bit better. And once the nerves are freed up, they start flowing normally, and everything starts improving.
Yeah. So with the adjustment, and I assume that now, of course, I know that once you do that, you need to follow up with, first of all, doing particular exercises and things at home, and or keeping those things moving, correct?
That's correct. Every patient that comes in the office, we evaluate their needs. I always give them great recommendations, and one of them is to stretch. I'll show them some easy stretches to start off with, and depending on their pain level and their tolerance, we'll start easy or might go a little more in depth with the stretches, but every case is different, so we have to treat everyone different.
Mm-hmm, mm-hmm. And then they can come back to you, and I mean, I'm sure that it's not going to be just one adjustment they need, or does that happen too?
There are a few cases. I've had a handful I can think of off the top of my head where one adjustment, the pain goes away completely. Ideally, that's not what we like. We like patients to come in to not only get rid of the pain, but to fix underlying causes of the subluxation, as it's called, or why the joint isn't moving. The pain is just one of the symptoms that there's something wrong in there. Mm-hmm. Of course, in my office, the most common reason someone comes into the office is because of pain.
Exactly. Well, just like any doctor's office. and most people aren't inclined to do the preventative kind of stuff, Dr. Dale, that maybe they might need. So they're liable to go out and, get up on that ladder and, haul some heavy things that they probably shouldn't have been doing in the first place, or at least if they were doing them, they should have been in better condition to do that.
Not everyone's in perfect condition, and it's not something that we can pick or choose. And life doesn't stop because you're in pain. But we do have to deal with what we get when they come into the office. Mm-hmm. If it's severe pain, we may have to see them more often until the pain goes away. Or if it's not severe, it all depends on the case. But I've had some patients come in 4 times a week, and it takes them a week or two before the pain goes away. I've had some, as I said, a handful of patients that one adjustment, the pain goes away completely.
Okay.
And those are the cases I like.
Yeah. And you do this evaluation. I think you do an X-ray, or
Yes, we like to do a complete evaluation,
or
X-ray, and see exactly what's going on. I have had 2 patients in my career. I've been practicing for almost 12 years now. I've had 2 patients that when I took the X-rays, I was very surprised with what we saw in the X-rays. Both of those cases, I had to send them off to an oncologist, a cancer doctor, for further evaluation because of what we saw, and it wasn't very pretty. But those are the only 2 big surprises I found in my career. So.
Well, it just goes to show you that if you are in pain, you need to have it checked out. I would think that would be the first order of business, correct?
That's true. I remember in college, back in chiropractic college, they taught us one of the worst things that people say is, "Oh, I thought it'd go away." Because it doesn't always go away. In fact, sometimes if we ignore it, it only gets worse.
Yeah, yeah. So What kind of licensure do you have to have as a chiropractor? What kind of degree or how does that work?
Personally, I got my Bachelor's of Science from the University of South Carolina before I went to Chiropractic College at Palmer College. In order to be licensed in the state of Kentucky, you have to have a bachelor's degree, and then you have to go to a chiropractic school and get a degree there, and then you have to pass the national boards, which I've known a few chiropractors that they've been able to graduate Palmer, but they weren't able to pass the boards.
Mm-hmm. So they can't practice unless they pass the boards, correct?
That is correct. They can't, if they don't pass the boards, they can't get licensed in the state.
Okay.
I have been licensed in a few other states, and some states have different requirements. Every state is slightly different, but because I'm licensed in the state of Kentucky, that's where I can practice.
Well, good. Well, we're glad you're here.
As for the schooling, if you look at what a chiropractor goes through at Chiropractic College, our schooling is almost identical to a medical doctor's. The very few differences, for instance, pharmacology as a chiropractor, we don't get any. Whereas a medical doctor has quite a few classes in pharmacology.
You're not allowed to prescribe medications then?
No.
Okay.
That's against my license.
Yeah.
One area where we do get more schooling than medical doctors is in radiology. We get quite a few hours more in radiology and in anatomy and physiology than medical doctors. So,
wow.
Very comparable to a medical doctor. I'll say I'm not a medical doctor, just like I'll say I'm not a physical therapist.
Yeah.
There are a few things that I can do which are similar to physical therapists, but I'm still not a physical therapist.
Yeah.
I'm a chiropractor.
Yeah. So, and I suppose that, like you say, at times, because of someone's particular condition, you need to refer them elsewhere, such as you mentioned the oncologist, and I suppose that's the same with a physical therapist.
Yes, if I feel a patient would benefit more from physical therapy, there's a few physical therapists here in Springfield that I like to send them to.
Yeah.
I feel it's a great way to help the patient. So if they will benefit from it, then it's good for them. If they need something from another provider, I'll send them to that provider.
And how would you say that the physical therapy differs from chiropractic services?
Where a physical therapist isn't trained as a chiropractor is in the adjustment, they do have a few manual techniques, and they can do some manual adjusting that's similar to chiropractic, but it isn't exactly the same. They don't get the same schooling in it that a chiropractor does, but they get a lot more in rehab. In other words, how to help mend muscles that have been injured and joints, get them close to back to normal as possible. So their training is really good and it's beneficial. A lot like the massage therapist I have in my office, she is very well trained in how to get the muscles loosened, how to get blood flow into the area to help the healing process. And as I said, it loosens it up so that it's much easier on me to do my job to get the joints moving. And it's easier on the patient too.
And yes, I'm quite aware of that.
I've had a few patients that I try to adjust them, and it just doesn't want to move. It's so tight.
Yeah.
But after the massage therapist works on them, it makes it much easier.
And that is the bone that doesn't want to move, or because when you do the adjustment, there's that cracking noise, and that is from the.
It's actually from the joint.
From the joint.
Yes. If you can imagine a joint there's a sac that completely covers the joint. It attaches to the bone, and so the joint has a fluid-filled sac in it. When the joint moves in the adjustment, the theory is, they haven't been able to prove it yet, but The theory is that the joint is made larger, and therefore it drops the pressure in the fluid, and then the gas comes out of the fluid. And that's that sound, the popping sound.
Oh.
And because of that, we like to feel that motion, we like to hear it, because it lets us know that, yes, we got it to move. There are a few instances on some patients where I get it to move and they don't feel it, but I can feel it.
Okay. Well, that makes sense. Yeah. Well, I just know from my own experience that, you know, I never thought I would ever go to a chiropractor, you know, because I didn't know much about them. But, you know, when I started getting this pain in my neck, I thought, I want to check that out. And, you know, it just helped immensely. So I don't know if it does for everybody, but it certainly did in my case.
Yeah, the most common reason people see me is low back pain, and then the second is actually neck pain.
Yeah.
I had a patient just the other day that came in. They didn't tell me anything about their health history when I was asking them about it, but when I looked at the x-rays, I said, "You had a car accident about 15 years ago." And they looked at me and said, "Yeah, you're right, I did." I forgot to tell you. So we can see things that have happened over time through x-rays. It gives us a great view. And one thing I like to tell my patients is, as we get older, we have to pay for the things we did when we were younger. So it's best if you get things taken care of as soon as possible, as soon as you know there is a problem, rather than waiting till later when, well, it may take a little bit longer, because as I told that patient, this didn't happen overnight.
Yeah.
This has been building up for the last 15 years. It's just now you're coming in to see me to take care of it today, so.
Yeah. Well, and often from those injuries, I think what happens, you know, just from what other people tell me in general, arthritis, you know, or I guess that's considered scar tissue. Arthritis is that correct?
That is one way to look at it. Arthritis, the general term, is just a degeneration of the joint.
Okay.
So it is something that can develop over time. In fact, it takes time for it to develop. It doesn't happen overnight. And that the same patient that I saw that there had been an accident 15 years before, it's evident because of the degeneration we saw on the x-ray. So arthritis is just the term for that degeneration.
Okay. So the degeneration could be caused from an accident, or it could be caused just from someone who's more inclined to have that happen to their joints, I suppose.
Well, yes.
I mean, because I know there are people that, just for example, you know, my mother had arthritis, and I mean, you know, lots of people as they get older get arthritis, and I suppose that's just from the bones getting, or the joints getting older, or is that correct?
In a way, that is correct. But for example, I've had patients come in that were 80 years old and their spine looks like they're 20. And I've had a couple of patients that are 20 and their spine looks like they're 90. It all depends on what they've been through. But one of the things that we can do is get those joints moving and help repair what we can. So not everyone is the same, and not everything we do causes it. In school, they teach us that there's 3 causes to what we call the subluxation, or the degeneration. The first is your thoughts. Stress is a killer.
I believe that. I certainly do.
Everyday stress is something that can lead to that degeneration. The second one is toxins. Everything we take in our body that isn't good for it can lead to the same types of stress on the system. And the third is, of course, trauma. Everyone's familiar with that. but they're more familiar with like slips, falls, trips, and car accidents. Those things they can understand. However, one day you're walking and you just miss a step, but you don't hurt yourself. That can cause what is known as a micro trauma, and a number of those over time can also add up. And a combination of all three, because we can't avoid all toxins.
Right, right.
And
I wish we could.
and life is a little stressful.
That's right. So so through your treatments, you can get those things under control and keep people free of pain. Does it actually heal the joint or whatever?
That is a good question. More often than not, all we do is we free up the joint so it's moving properly, and the body then heals itself. There is a point where there's not a whole lot I can do. It depends on the amount of degeneration. If the spine is completely collapsed and the bone is on bone and it's made a bridge to where it is fused, I may not ever get that joint to move, and I may not want to. So it's something that not every joint can be helped. However, if the joint is fused, the segment above it and below it are going to start having to overcompensate for that segment, and those two segments will start degenerating. So I've been able to help a lot of patients that are in severe degeneration because the segments above and below it are deteriorating. We need to stop that or slow it down at least.
Okay.
So to answer your question, the segment that's fused, we may never fix that. But if we can get to it before it's fused, then we can either stop it, slow it down, at least improve it.
That makes sense. That's good. So then one more question I need to ask you that I can think of is, do you ever is there ever a problem when you try to adjust someone? Like, for example, can you actually do damage to them?
There are risks to chiropractic care, and I try to go over these with every patient. The most common side effect, to say, of chiropractic care is bruising. I've bruised a few patients in my career, but it's not very common. So that is one of the side effects. It's the most common. The next is we can break bones. In my 12 years, I haven't ever broken a bone. But I have heard of chiropractors who have. So it is a possibility. One of the reasons why we take x-rays is I can see how strong the bones look on the x-rays. If they're thick enough and have enough density, then most likely we're not going to break a bone. But if the bones look very frail and very thin, if the patient's very old and the bones look frail and thin, I may consider a more gentle technique, therefore limiting that risk of breaking a bone. But I've been told by one of my teachers back in school that if you haven't broken a bone, you haven't been practicing long enough. I'm still looking forward to not having to have that happen. I still take precautions. The final side effect of chiropractic care is there have been a few deaths, but it's very rare. I believe the latest research, it's 1 in every 3 million. Since I haven't adjusted.
And what would that be from? From an adjustment?
Normally it's from the neck. If we don't screen the neck like we should, and the carotid arteries are a little bit plaqued. They have hardening of the arteries, and we stretch them. It can cause a minor tear in the artery and then cause a full bleed and a stroke. At least that's what they say. But there is no direct evidence that on some of the cases that it was the actual adjustment that caused it. So, as I said, the evidence shows maybe 1 in 3 million. There's some evidence that's even higher, a higher ratio. So, But
Well,
it's still
I'm
a
glad
possibility.
you've never experienced any of those, Dr. Dale.
I am too.
And I know you have a pretty big clientele, and I mean, I know a number of people that use your service, and we have other. I know we have at least one other chiropractor in the county, and so I know a lot of people that just swear by these services. So I think, as you said, it's been around for a long time.
1890.
1890. So I'm sure all the time that things are just like any of our medical services, that there's new techniques and new information that helps you be a better chiropractor.
Of course, I have to go to at least 12 credit hour continuation credits every year here in Kentucky. And of
Okay.
course, 6 of those have to be earned in the state of Kentucky.
Okay.
I can get
So that-
more, and I'm always looking for great classes for more information. And in chiropractic, there's more than 500 named techniques. So there's
Wow.
always more than one way to adjust a patient.
500. Whew.
Well, when we look at
That's a
medical
lot.
doctors,
That's a
there's-
lot to remember. So, so that keeps you up to date on things, doesn't it?
Yes.
So, well, now if I just want to say that I think you provide a good service here, and I'm glad we've got you in the community. And I know you have a great massage therapist. And so if anyone has any questions or would like to contact you, how do they do that?
They can contact my office at 859-336-7000, or they can look us up on the internet at springfieldchiropracticcenter.com.